Go.
Clebley, is it on? Okay. Hi, Dr. Scott Keller, coming from CrossFit Lincoln today. Zane's with me. Clebley's videotaping, so if it's bad, blame him, all right? What we're going to do is continue on scapulothoracic stability stuff today. All you're going to need is a little kettlebell, and by little I mean light, so this isn't going to require a huge amount of weight. We're going for some proper activation today. So just like in the past few weeks, for mobility, what really affects the shoulder complex here is if we're really tight and overactive in the pec group, so do some pec release. If we're really tight and overactive in the lats, so both of those groups are going to pull us into an internally rotated forward rolled position of the shoulder. And then obviously also we need correct thoracic spine extension. So you can do some foam rolling and cross ball peanut thoracic spine extension exercises as well. So that'd be mobility this week, kind of to prerequisite this next activity or this next exercise. From the back side here, I'm just going to explain for a couple minutes proper mechanics of the shoulder blade or the scapula, okay? Especially in a press or overhead position. So a lot of people will get impingement type stuff, pain on the top of their shoulder or in the inside of the shoulder in the labrum, okay? And that is due to when we go in an overhead press position, my hand is his shoulder blade, and I shrug and go up, it's going to rotate that shoulder blade or that scapula up and forward, which is going to close down the space where the tendons of the rotator cuff are, basically causing a pinching sensation, or what we would call an impingement syndrome, all right? So that is a bad position of the shoulder. It also decentrates the joint of the shoulder, which basically means the ball and socket is pulled up like this, where it should remain in the middle of the joint. So it does some bad stuff, basically. So what we want to have happen here when we go into a press, once again, my hand is his shoulder blade. As he goes up, his shoulder blade should go down and around his rib cage. So it's kind of what we would call a downward rotation or a depression and then an upward rotation of the shoulder blade going this way. If you can appreciate what that would do on the top of the shoulder is it opens up the space where the rotator cuff tendon lives, and it allows it to move freely and not be pinched. Okay, so what Zane's going to do here is you can do this without any weight just to see if you can do it correctly. Is try to go into a press position and really focusing on engaging the lat and the serratus here, getting that shoulder blade to come down and around like this without overly engaging his upper trapezius here or shrugging his shoulder. Okay? Same main principles apply from the past weeks. We want to stay tight and braced in our core, rib cage down, the shoulder we just talked about, and also engage and retracted in our chin to keep a neutral cervical spine. All right? Now, the next challenge is going to be to use this kettlebell in a bottoms up position. So you're going to hold it in this position here by the handle, and then I'm going to have Zane repeat the same thing going into a press position. All right, so he's going to start here and go ahead and start pressing nice and slow, concentrating on that down and around, keeping his core tight so he doesn't excessively extend here, trying not to shrug right up here. Okay, do a couple more reps. And I know it's hard for you guys to see, but this upper trap is not really overactive in Zane. He's doing a really good job essentially of getting that rib or that scapula down around the rib cage. And if he tells you he's probably feeling it, he's really trying to engage this area right down here, so that serratus and that upper, or middle and lower trapezius and the lat, okay? So you're gonna do probably just 5 reps on one side, switch, 5 reps on the other, and then try to go for 2 sets on each side, so a total of 10 reps per side, all right? That's it for today. Really focus on this stuff, guys. If you struggle with feeling it down through here, more than likely you have some massive mobility issues in your shoulders, and so you've got to make sure you shut off those pecs and those lats before you're able to even engage this stuff down here. So pretty complex, but if you have questions, don't hesitate to email me, Scott@synergylincoln.com. Ask the coaches, and they can forward it on to me. Thanks, and good luck this week.